Hi, I'm Dr. Mark Tam. This video, we're going to talk about how to look after your newly transplanted hair. Immediately after your hair transplant procedure, it is vital that you look after it the way we would like you to. They will give you the best chance for the hair to grow in the optimal condition. First of all, for your newly transplanted hair, all you need to do in the first 3 days is number 1, do not touch them. Do not touch them with your hands, fingers, nails, comb, hat, helmet, etc. Secondly, we want you to spray the saline solution we'll provide you. Spray your newly transplanted hair with the saline solution every half an hour or so. Thirdly, we'll give you some medications. For the medication, there's 3 types of medications. Some painkillers, some anti-inflammatories, and antibiotic cream. For the painkillers, you have been taking some during the day. You may be able to take some more during the night as well. And if the next day when you wake up and you still feel that you need some pain relief, please do so. For the anti-inflammatory to control the swelling in your forehead, you have taken some anti-inflammatory during the day. You'll continue to take those once a day, those in the morning for the next 3 days. For the antibiotic cream, what I want you to do is start putting at the donor area after you take off the bandage, twice a day for the next 5 days. After you take off the bandage, you have a wash in the donor area. What I want you to do is rub the fusidin cream on the donor area twice a day for the next 5 days. After 3 days, you can start washing your newly transplanted hair. When you do your first wash, all I want you to do is work up some shampoos in your fingers and apply to the transplanted hair gently. You can rinse it with a very mild shower, or if you're concerned, use a plastic cup to fill the water and pour it over to wash away the shampoo that you just put on. Very important that you do wash your hair, your newly transplanted hair, on day 4. I want you to wash it once a day, every day from day 4. After the first couple of wash of gently touching the newly transplanted hair, I want you to slowly start with a circular motion on the transplanted area. Gently, but surely, after about a week or so, you should be doing soft rubbing motion on the transplanted area. When washing your newly transplanted area, it is important to be aware that you shouldn't pick the transplanted area. If you have got scabs in the area, please do not pick them. They will fall off naturally. It's usually happen about a week to 10 days from the treatment. For the donor area, where we took the hair from the back and the side, when you leave us, you usually have a bandage in the back. What I'd like you to do is keep the bandage on overnight. When you wake up in the morning, you can take off the bandage. When you take off the bandage, please wet the bandage first in the shower before you take off the bandage. It is normal to see a few blood spots in the donor area after your transplant. When you take off the bandage, you may see some blood dots on the bandage, and that's normal. If you experience any bleeding in the back, just use some of the gauze, put a bit of pressure on that, and that should stop the bleeding. After you remove the bandage in the back, you can start washing your donor area. You can almost wash the donor area as normal, as they are quite resilient. And I want you to do that once a day for the next 1 week or so. After you wash the area, you can use the fusidin cream we're going to give you to rub evenly onto the donor area. Just to recap, no touching, spraying the saline solution every half an hour, and the medications. And we touch on how to look after your donor area in the back. I'm going to move on to talk to you about some general instructions. For the first couple of days, please take it easy. Don't do anything too strenuous. If you were to do any exercise, give it about 7 days before you go back to your cardio exercise. For heavy weightlifting, it's best to leave it about 10 to 14 days after the treatment. After 3 days, when you start washing your newly transplanted hair, it's safe to touch your newly transplanted hair. So should you want to wear a baseball cap that is not touching the newly transplanted area, it is safe to do so. But if you were to wear any headgear that is touching the transplanted area, I'd like you to do that in about 2 weeks' time. If you're getting in the car after the transplant, just be very careful. The treated area still feels numb and you can't really feel where the sensation is. Try to avoid any accidents by being very careful, slowly getting in the car. And just be very wary that you have enough space getting in and out of the car. The evening of your transplant, you can have a light evening meal, preferably soft diet and with light salt. Avoid really hard chewing items such as well done steak, etc. because some of the chewing muscle may be connected to the temples area. And we just transplant some grafts there, and it's best to avoid challenging them in the first night. If you smoke, it is best to avoid smoking for the first week. After 4 weeks, you should go back to your normal life. You can have a normal haircut, you can go swimming in the pool, go swimming in the sea, you can wear your normal headgear after 4 weeks. If you need to expose your newly transplanted hair for a prolonged period in outdoors, during the period of 3 to 6 months, please be sure to protect it by wearing a hat or to apply sun cream in the transplanted area. It is not advisable to expose your newly transplanted hair in the first 4 weeks for a prolonged period. If you experience any swelling in the forehead despite on the anti-inflammatories, it is advisable to keep your head upright, 45 degree, and use of ice pack is recommended. If you're on anti-hair loss treatment medications, you can restart your topical minoxidil after about 10 days to 14 days from the transplant. If you are on finasteride, oral finasteride, you can restart anytime after the treatment. If you're on topical finasteride, it is recommended you start 10 days to 14 days after the treatment. Please note, it is normal for some of the transplanted hair to fall off first before it starts to grow. This is what we call shedding of the newly transplanted hair. It usually happens from about 10 to 14 days from the transplant, and it can carry on up to about 3 months or so. During this period, what you will see is transplanted hair will fall off first before it starts to grow. It is difficult for us to predict exactly how much shedding one may experience. Some might experience less shedding, while some will experience a little bit more shedding. And usually it happens between 2 weeks to 3 months. So what you will see is the transplanted area will look a little bit less dense, will look a bit patchy. And it's a gradual process. Just when one patch starts to disappear, there may be another patch appearing. And there may be some unevenness comparing the left to the right side. And that's totally normal. From 3 months onwards, this shedded hair will start to grow back. At about 6 months onwards, that's when you start to see the result of the transplant slowly coming through. The final result is usually about 10 to 12 months from the transplant. It is important to book your follow-up appointment with myself about 10 to 14 days from the transplant as your first follow-up appointment. We'll then see you again at about 10 to 12 months. Of course, in between the appointment, if there's any questions, you can give me a call, send us an email, or just let us know if you need any help. Thank you for watching.